So what's UOSSM, as Yazan mentioned, what UOSSM, as Yazan mentioned, is a United Organization of Medical Relief. I'm going to go over how did it start, what's the committee we work on, and all those things. And hopefully by the end of this presentation, you will have an idea what we have been doing over the last 3-4 years. Now, we consider ourselves, we have been quite a bit slow, to tell you the truth, in comparing with the disaster that has been going on there, as everyone knows. So, why we care, we'll go over the situation, the circumstances, what we did, how did we divide ourselves into 4 committees: primary care committee, trauma committees, educational committees, psychosocial service, and what's the further directions. It's beyond any imaginations. Everyone knows that, and this is not in your pictures. Probably Syrians, which is probably that's counted 300,000 killed, many children, over 1 million displaced, actually over 11 million displaced, and 1 million injured. And I can tell you for a fact, from the way I see things there, 2/3 of the injured, really disabled, either lost limb or traumatic brain injuries or severe ortho injuries, and etc. You know, the disaster there, that's 80% of the hospital got destroyed, and 80%, at least 70, I would say, I will tell you for sure, 90% of the medical staff, healthcare professionals, and also that fled the countries, that's left them just 5-10%. Aleppo, for an example, I swear that it used to have 1,500 physicians. And 2 years ago, just what's left is 25 physicians. I can tell you now, just 15 physicians left. That's from physician perspective. Now, so that's alluded to the idea of UOSSM, or healthcare organizations or medical relief organizations, started in France by Abbas, whom has been the headquarters for UOSSM. Then another countries pinched in, like in Europe and US. Then now we are in Canada under the umbrella of United Organization of Medical Relief for Syria. Now, I'm sorry, just back there. So now all the Syrian countries, they have been getting grants from the governments in supporting Syria. The US got quite a bit of grant. SAMS got $20 million in support of Syria. That's because it showed unity, showed a good work, and a very reliable work, a reliable team. And now we are benching in Canada. We started Canadian Relief for Syria, then we merged into UOSSM-Canada. Now, I'm going to go over the first committee, which is a primary healthcare committee, as simple as you hear. Now, we have children, we have women, we have elderlies, all these need vaccinations, needs OB-GYN service, and all these things. And that's the mission of this committee that meet on weekly basis. They have 8 centers across all Syria, and each center is supported by this committee. They meet on weekly basis. They discuss what's the needs, what's the supply, and all those things. And based on that, they decide about the sponsor, about the support. Now, yeah. So for an example, we started in Aleppo, Idlib, in suburb of Latakia, Hama. We used to have one in Qalamun, East Ghouta, excellent center in East Ghouta, Al-Fayha, primary care center in Dara, 8 centers all across the countries. Now, we used to have centers in the east, but then very much shut down due to the political circumstances. Take an example, the medical center Al-Fayha in Ghouta. It serves 400,000 people, women and children and elderly, and all civilians. Now, what did it cost us to open these centers? It cost us $27,000. Actually, we are proud that this came from, all of you came from Canada. We established that center. However, the running cost of this at $15,000 has been running by Abbas in France. That's how we work. We start something, others complete. Others start something, we complete. We work all together under one umbrella in order to accomplish. Now, this is a kind of a little bit of stat between around 300 cases of internal medicine, pediatric around 1,000, gynae and the rest there, just to give you an idea about what we do. Now, these primary care centers has an electronic record, and for that reason, we monitor their work. And based on their work, we provide the support. So we are trying to do it in a kind of a scientific fashion in a war zone. Now, we didn't do it the first day. We didn't do it the first year. It took us 2 to 3 years to establish this mechanism. Now, the second committee, which is a very critical committee, called the Trauma Committee. Now, I'm part of this Trauma Committee. This is mainly consistent of 14 subspecialists in neuro ICU, medical ICU, trauma surgeons, orthosurgeons, and all. We meet on weekly basis through teleconference, through Skype, from all across the world. All these organizations under one umbrella of UOSSM. We bring representatives from each area in Syria who give us an update about that area. Now, we start with the area that hugely damaged. Like for example, last week we started with a suburb of Idlib after the Clorox, like just the chemical attacks that happened just last week. And we decided what their need, they're representative of that area. We have represented in each area who give us an update about that area and what they need, and then all these organizations pinch in helping. So alhamdulillah, like for example, we needed 10,000, few thousands from here, few thousand from here, few thousand from here, and you find the barakah and all this that just came on. Good. So what we do, we assess the field hospitals, we assess the disasters, we assess the medical warehouse, and all these subspecialty care. Now, I can tell you, as I told you, like around 200,000 Syrians so far died, or 250,000. But there is a 1 million injured. Now, if we don't do that, this 1 million, the death will increase from 200,000 to 1 million. And what we are doing, what we are accomplishing, the 1 million, we turn it into 800,000 survival with a lifestyle. Now, another major issue is that a lot of physicians left. Well, like just 5–10% of the physicians stayed there. Now, the other disaster which we face is these physicians. You know, they are heroes. Like you just imagine they are working in a terrified area, in a war zone area. What they are asking, please take care of my family, and I will take care of the patients here. Take care of my families. So what we did, we created a sponsorship programs where we sponsor physicians by physicians in all across the world, like very much like orphan sponsorship programs. Now, this is an example. Like we utilized around $1 million, $1,100,000 in 2013, 2014 as a salary for all physicians in Damascus. Now we focus on the surrendered area, Damascus, Daraa. I think this is the major areas that we always focus on. Why? Because this is surrendered. You know, I will tell you something. Any relief organization, they're not going to touch that area. It's going to be very much touch the northern side or the south, or sometimes not the southern side. I mean, I'm not sure about Jordan, but the northern side where they're back to Turkey. So very much we cover all medical staff through this granting from several organizations. Now, the next thing is a medical supply. We have a warehouse across all Syria. My friends in Calgary knows about this. We have a major warehouse in Daraa. And actually this warehouse in Daraa established by Calgary, by you. And we very much put around $1 million supply to the warehouse in Daraa. And half of it, I think 2/3 of it, or just half of it, just came from Daraa. Quite a bit dry in Calgary. Edmonton is not that dry. It's more dry, actually. So $1 million, very much we put it in the south side. Half of it just very much come from came from Calgary. When we established the warehouse, actually, Yazan knows about that. The lump of the money that came from Calgary established that warehouse. In the northern side warehouse, it is the $6 million, huge support from Islamic Relief and different organizations. So not only this, the medical containers, Calgary is a lead in that actually, and several medical containers. This is, there is no, this is a gaining game. This is a gaining. You get an equipment which is worth $1 million, $2 million. You send it by containers. It costs $6,000. The utility, that's just the cost of all of it is $10,000 for $1 million. This is gaining. This is a huge gain. And I don't know how many containers have been sent from Calgary. Now, this is a picture of our treasury level 1 trauma centers on the border of Turkey and Syria in Bab al-Hawa that we established. We are looking to establish exactly the same one in East Ghouta. We already had one in East Ghouta. We're going to flourish it. And I spoke with Dr. Isa. We're going to do one in Dara and Mashfar Dr. Ajaj, inshallah. So the treasury centers provide the microbiology lab, dialysis units. That's an example. CT scan, and we are getting, hopefully we're going to get, we got an MRI donated by German government. We're going to try to implement it there, but just we have a little bit of technical issues about preparing the rooms and all these things. And blood bank, it cost us $60,000 blood bank. It is having 3.5 million. It's the first blood bank in the northern Syria. And telemedicine, where we monitor, monitor patients from here. Dr. Khurshid here has been helping, and he has been part of our team. And neonatology / tele-ICU and tele-neurology, where we monitor patients from here. And we have 6, actually now it's 8 OR rooms. 4 emergency OR rooms and 4 subspecialty, where subspecialized surgery done. Now, we cannot ignore the psychiatric aspect. We cannot ignore it. This is by Dr. Salim, a great fellow. Actually, he was my student. I swear he was my student, and he became a resident. Now, I think next year he's going to be staff at the University of Alberta, but I still treat him as a student. So he started this beautiful project. It's called the Markaz al-Qalb, or Heart Mental Health Center. Now, if you look at the last report, 40% of the Syrians has a mental illness. Now, I think this is underestimated. I swear, it's more than 60%. More than 60%, more than 80%. Bombarding and all those things is just that's the minimum. I said more than 80%. This is the center, psychiatry clinic, psychology care, counseling, health support, and psych support for children, and they have a psychologist, and etc. They see this, like over the last 3 months, they saw over 250 cases. Now we are building a psych center now, trauma psych centers that's in Sarmada. This is the Markaz al-Qalb or heart, like it's called Markaz al-Qalb, it's good in English, but the heart, what did they name it? The heart centers, the saving heart centers or something, Markaz al-Qalb. And it should open by next month. The training committee. Dr. Betty is actually, he's a native physician. He's a marvelous man. He's from France actually. And he is specialized in disaster medicine. He has been all over the world just treating disasters. He said he never seen something like that. He created a team of experts, and what he did, he trained physicians and nurses in the war zone. He trained 2,300 doctors and nurses. And he built up 3 centers, one in Bab al-Hawa, which we did provide for him, and one in Lebanon, Arsal. It's bending now. They are moving it around to Buqa due to the problem in Arsal. And he did establish one in Jordan, on the border of Syria. And that's very critical. Now, the last thing I want to talk about, electronic record. For the last 2 years, What we implemented, electronic trauma record. What we do, we try to record the trauma all across Syria. Why this is important? Because it develops scope of the problems. We can go to the UNICEF, United Nations, WHO, tell them, look at that, that's what we have. That's the start of things. We can do resource allocations. Resource allocations, this hospital had 200 injuries, major surgeries by criteria, by scientific criteria. They need more support than another hospital, had 10 surgeries. And that's where we developed equalities. Now it took us time to develop that. It just us 2 years to develop this electronic recording. This is an example, for example, in Ghouta, and we use a coding system for the surgery, so we can code any areas. And we tell them frankly, listen, if you don't provide us with this coding, there is no way of knowing how much to support you. And if we support you more than others, we might do harm. Now, this is this is in Arabic. This is a Bab al-Hawa, and this is the start of surgeries. Started by eye surgery, ortho, general, vascular, facial-mandibular, ENT, pediatric surgery, neurosurgery, scope, and urology, and chest. Now, we build up rehab centers. We need to build up rehab centers because after the surgery, after the trauma, you need a post-op care. And we build up one in the north side and one in the south side. And Mashfat Dr. Ajaj. And that's provide the post-rehab care. Not only this, we build up a prosthesis center in Turkey. The prosthesis, one prosthesis costs us $20. If you want to buy it, it costs like $500. So instead of keep buying prosthesis, and this problem is not going to finish tomorrow, we end up building a factory. And that's by excellent physicians actually in UK, Dr. Salah Jabal. We gather medical volunteers from all over the world and going there, bench there, working there in Bab al-Hawa or in another hospital, Mashfar al-Amal hospital, in the Turkish side. That makes us come to know Mark Cameron, who's going to give his talks. Excellent paramedics. He has been going there, helping there. Dr. Notes, please listen to him on I think in BBC. Excellent physicians. Vascular surgeons has been going to Aleppo to help children there. Dr. Notes, I mentioned, and Dr. Sohail, hand surgeons. I've been going with them several times. You know, and then that's an idea about the tele. You want to run this video? So then, we couldn't stop here. We need to work at home. So this patient is in Aleppo, and I'm actually in my office. This is the map of Alberta. I'm in my office, and I'm treating these patients from my office, just to have an idea. And he's comatose, and give them an instructions. And actually, the beauty of electronics, and I can control the camera from Alberta. The camera that's focused on the patients in Aleppo, I can control it. We can run it. Next one. So now, the next step, some equipment are very expensive. A few friends just finished in with a novel idea, came with this bag system. This bag costs $35. This is to clean wound. If you look at the equal one, you know, buy from the market, it's $2,000. So it has been tested in several hospitals. And it showed it's very effective. Now we are making it in Turkey, and we are spreading it inside.
It was developed in Canada?
It's developed by Dr. Hisham al-Sahar in Toronto. Now, Vancouver got invaded by this, and they developed the other called orthopedic drill, and that's for orthosurgery. And again, it costs like $50 or $100 for a tool that's cost over $2,000. I think there is I hate to say, but I don't want to see that, but unfortunately there is a wisdom behind disaster. So my hands tight, but that's what I see where I go there. Just see on the walls of Hanaqauna. In English, we will stay here. These people can stay there. You know, these people have been there all over for many years. They're not going to leave their countries. We need to support them. You know, we work all together. So we believe that Siyadullah Ma'ajama. We need to work together, and that's the way we can accomplish things. And that's the way we did accomplish things. Unity is the strength, and diversion is the weakness. You know, we always believe in hope. I see it in the eyes of these beautiful kids. It has nothing to do with all this. You know? And all but, yeah, they give us hope. So we started, we started really by warehouse, and I will say smuggling medical supply inside, into building rehab centers, into building hospitals, into education, into telemedicine, into novel ideas for equipment. For that reason, we believe UOSSM is awesome. Now, you think we did a lot and we're going to do a lot? No, we did this like the drop in the lake. I think it creates circle after circle after circle. No matter what you do, you think it's not going to do anything. It does a lot. And that's the analogy, is the drop in the lake, I think. Yesterday is the Mother Day. Not today. Yesterday is the Mother Day. We promised every mother that we're going to keep doing what